Everyone. I am Dr. Mamatha B. Patil, representing India. At the outset, I thank the organizing committee of WOC to giving me an opportunity to talk in this esteemed conference. Since 2 days, I am listening and hearing all the topics related to the obesity management, starting from the definition to the recent advances, and I congratulate all great speakers. Okay, today I am going to talk on obesity in women. I am restrict my talk to the some of the health issue related to the obesity in women. These are my contents my of talk. Obesity in women is a growing global health concern with significant physical, emotional, and social implications. Obesity is due to excess accumulation of body fat. Several factors contribute to obesity in women. Obesity leads to various health consequences, especially abdominal obesity, namely the insulin resistance, which in turn leads to the type 2 diabetes mellitus and cardiovascular complications. Abdominal obesity, especially in reproductive age group, especially in the puberty as well as the pregnancy, post-pregnancy, as well as the menopausal. Addressing obesity in women, it requires multifaceted approach, not only individual lifestyle measures, it also includes the societal efforts to improve access to healthy foods, promote physical activity, and reduce weight-related stigmas. Obesity is a medical condition in which excess body fat accumulates to the extent that it may have a negative effect on health, leading to the reduced life expectancy more than 3 to 10 years, according to one study. According to WHO rates, obesity and overweight continues to grow in both adults and children from 1990 to 2022. It increased from 7% to 16%. Global incidence of obesity is high, with more than 1 billion people are affected worldwide. Among that, India ranks 182 out of 192 countries. Hence, it becomes important to discuss the related to the obesity in women. Coming to the prevalence of obesity, the prevalence of obesity is rising. A recent study of WHO revealed that more than 1 billion people worldwide are classified as obese. The exact figure is 650 million. Recent study published in Lancet, 70% of India's urban population is classified as obese and overweight. India ranks third, just behind the USA and China. The Lancet also revealed 30 million adults in India are either overweight or obese. 62 million diabetic Indians exhibit obesity-related abdominal adiposity. The incidence of obesity surged by 9% among women, amounting the 4.4 crore, as well as 5% among 2.6%. So double the male incidence. 26% of the non-pregnant women ages 20 to 39 are overweight and 29 are obese. This is the BMI cutoff. And since yesterday we are seeing these slides very frequently, just I'll skip this slide. According to the Indian, as well as the Asian Indian and Asian African, more than 27 BMI will be considering as obesity. Coming to the epidemiology, obesity is the latest, fastest growing cause of diseases and death in Western countries. The overall prevalence of overweight and obesity are coming the 44.2% and 41.1% respectively. This is the global incidence of obesity. Incidence of obesity is found to be high in developed countries, especially in US and UK. And even the developing countries also nowadays, they are taking the upper hand. This is the same slide. More than 1 billion people, according to the recent WHO, more than 1 billion people are overweight. Among that, 650. This is not 300. This is 650 million. They are obese. 25% of the non-pregnant women aged 20 to 39 are obese. So coming to the prevalence of obesity, more than 27.5, the BMI, they are doubled. Morbid obesity, more than 37.5, it is quadrupled. And super obesity, that is a 47.5, it is a 5-fold increase. These are the risk factors for obesity. Just I'll glance once more. The dietary risk factors are diet rich in carbohydrates, diet especially the trans as well as the saturated fats, excessive alcohol intake, there is a 7 calories per gram, empty calories. Diet low in fruits and vegetables which contain essential vitamins and minerals. So these are the dietary factors. One of the important risk factors, the dietary risk factors in obesity. Coming to the environmental factors, mainly there is a sedentary lifestyle is more nowadays, and the lack of the area parks, sidewalks, affordable gyms, and oversized food portion. They are demanding increased physical activity. Coming to some of the genetic factors, mutation of some of the genes, they are also responsible for the obesities. And coming to some syndromes which are associated with the obesity are the Cohen syndrome and Carpenter syndromes, etc. And coming to the stress, stress is one of the important factor which will cause so many hormonal as well as the metabolic effects on the body, and in turn it will cause the obesity. Coming to the measuring of the body fat, BM body mass index is the most common benchmark for the diagnosis of obesity, especially in the community level. However, BMI fails in many counts. Not only it is unable to distinguish lean from the fat body mass, but it also does not take race and sex differences. But still, this is one of the commonest parameter to assess the obesity in at least in the community levels. Then coming to this, other measures are the waist circumference and the waist to hip ratio. It also fails to distinguish visceral fat mass from the other body components. Most accurate methods like DEXA, dual energy X-ray absorptiometry, they are available, but because of they are not cost effective, so it is not practiced in very routine in clinical practice. This is the obesity classification. More than 30 is the class 1, 35 to 39 is the class 2, and more than 40 is called morbid obesity, the class 3. Then coming to the assessment of the obesities, whenever you will find any of the obese persons, the first thing we have to ask is the history, since when they are start gaining the weight. That is the first important thing. And second thing is about the diet. What all different types of diet they are taking, then roughly you can calculate the calories, and roughly you can find out the types of food, whether it's carbohydrates, fats, and proteins, which is excess in their diet. Second one is the physical exercise. What type of physical exercise they are doing and how many minutes they are spending. Different types of physical exercise we have to ask in detail. And because nowadays the sedentary lifestyle is more common, so with that idea, that is one of the major factor which will contribute for the obesities. Coming to the medications, we have to ask for the present and past medications what the patients are taking, especially the chronic long steroid therapies which will cause the obesity, antihistamines and antipsychotic drugs, anti-epileptic drugs. These questions we have to ask without missing any of the histories, especially the drug history is very, very important. The second one is the age of onset of the obesity is very, very important, especially in case of women, whether they are start gaining the weight in their pubertal age or pre-pregnancy or at the pregnancy or postpartum or menopause. In which life stage, which life stages the women are getting the more, they are becoming obese in these life stages. So we have to ask specifically since when they are getting the weight gain. And third one is the family history of obesity is very, very important, because some of the genetic background we can think over. Then psychological conditions like bulimia and night eating syndrome, they are also very important. And fourth or fifth one, the sleep and stress factors, because chronic stress, it will also contribute for the increased production of cortisol and leading to the Cushing's like disease. And sleep disorders, many of the physical elements, especially the related to the chronic asthma, chronic GRD, or chronic headache, or chronic depression and anxiety, they're all contributing for the sleep disturbances. So which in turn, they will cause the obesity. One study they've conducted, that is a nurses' health study they've conducted, where some nurses, most of the nurses are involved in that, who are doing the continuously night duty. They are mainly responsible to develop the obesity. So this study was conducted in a multiple centers actually. So on that basis, they assessed that chronic sleep deprivation is one of the cause for the obesity. Symptoms suggestive of endocrine disorders, especially the hypothyroidism, is very, very common in case of females, and Cushing syndrome. So the symptoms related to the history of overweight or gaining weight and history of hair fall and cold intolerance and some of the forgetfulness and recent changes in their memory, all this history will contribute for the hypothyroidism. Similarly, the Cushing's syndrome, some of the symptoms they have to ask for. And detailed physical examination is very, very important. Mainly, we have to look for the signs suggestive of the hypothyroidism, especially the dry scaly skin and the non-pitting edemas, then acanthosis nigricans and acne or skin tags. Especially, it will suggest the skin tags and the xanthoma will suggest the hyperlipidemia, especially the hypothyroidism and Cushing disease. They will be invariably they'll be having the hyperlipidemia. So these clinical signs we have to look for. And screening for the obesity. So usually the screening for the obesity, annual checkup is very, very important, especially once we found out the patient is obese. Mainly the screening depends upon the patient's weight. Then how frequently the patient is gaining the weight. Means at least once in a month, we have to tell the patient to record the weight. If there's a patient is gaining the weight very fast, then we have to find out underlying factors or underlying diseases which are contributing for the weight gain. Okay, not only the sleep disorders, especially the drug history. Sometimes patients without our knowledge, they will go on consuming the drugs and they will not reveal to the doctors. So these things also we should keep in our mind. And the third thing is the thyroid function test is very, very important. So the progressively there is a weight gain is there along with some of the hypothyroid symptoms, and especially the woman, especially in the pubertal age as well as the menopausal age, the thyroid incidence is very, very common. So I have to submit the patients for the thyroid function test and lipid profile to rule out the hyperlipidemic state, and reproducible hormones, especially the LH and FHH, to rule out the genetic causes of the obesities. Obesity in the various stages of in women, obesity and PCOS. That is polycystic ovary syndrome. Obesity leading to the insulin resistance is one of the major root cause for the PCOS, leading to infertility. PCOS, the incidence is 2 to 26% women during their reproductive years. Obesity associated with PCOS leads to type 2 diabetes on long term. Then this is the brief the flow chart which will depict the PCOD, how it will be causing. Excess body weight, it will cause the insulin resistance. Insulin resistance in turn, it will cause the hyperinsulinemia. Hyperinsulinemia in turn causes the decreased sex hormones, binding globulin, increase in the insulin like growth factor 1, and thecal cell hyperplasia in the ovary. So this thecal cell hyperplasia in turn causes the increase in LH and anovulation. Obesity leading to the PCOS. High calorie intake, it causes increased leptin as a decreased neuropeptide Y, then increased melanocortin. Then in turn, it will cause the increased hypothalamic gonadotropin releasing hormone. And increased gonadotropin, mainly it will causes the LH. So insulin and leptin act peripherally on the ovaries, where leptin potentiates the insulin-induced thecal cell proliferation and increases the intra-ovarian androgen levels. So most of the time, the PCOS, it will cause some of the clinical symptoms in the form of the anovulation and irregular bleeding and hirsutism in very severe cases, and weight gain and acne. Along with that, acanthus nigricans. So these are all the symptoms and signs we have to look for whenever we suspect the PCOS, especially in the pubertal age group. Then coming to the obesity in infertility. Obesity in women has been shown to increase the time to conception, increased time to conception. The relative risk of anovulation is 9.5% in women with BMI is more than 32 kg. While ovulatory but subfertile women, the chances of spontaneous conception decrease by 5% for each unit increase in the BMI. So as the BMI goes on increasing, the women, they are more prone to develop the infertility or subfertile stage. And there is a chances of conception also, it will be delayed. Obesity causing infertility. Then what are the effects? What are the hormonal changes will occurring? So, and what is the effect on the ovaries? So intracellular accumulation of free fatty acid is leading to the overproduction of reactive oxygen species and intracellular stress reactions, which in turn lead to the molecular defects of the oocytes. Insulin acting via IGF-1, insulin growth factor 1, enhance IGF-mediated steroidogenesis and increase ovarian androgen. So low adiponectin and high leptin levels are associated and causing the hyperandrogenemia. This hyperandrogenemia, it in turn causes the granular cell apoptosis. Then effect on endometrium. What is the effect on endometrium? Analysis on the implantation rates among recipient women in different BMI categories following the oocyte donor in vitro fertilization shows trend of low implantation rates in obese women. So obese women, the chances of becoming the pregnant as well as the it will be delayed. So because of the some metabolic or the hormonal changes on the bodies. Effect on the sexual dysfunction. So it will cause low libido, difficulty arousal, difficult to reach orgasm, and early orgasm. So these are the changes will occur. So these are all responsible for causing the infertility. These are mainly due to the hormonal and some metabolic effects in the obese woman. Then impact of obesity on the ART, reproductive techniques. So ovarian stimulation and gonadotropin requirement, it is increased, and response to the stimulation, it is a poorer, and oocyte number also it will be reduced, and quality of the oocyte also unchanged in some of the studies, and fertilization it will be decreased. Then embryo quality, it will be poorer in some studies. Then pregnancy rate reduced in some studies. So there's the different studies, they have given the different conclusion. Then coming to obesity and pregnancy, increased risk of miscarriages is common. The premature deliveries and premature rupture of the membrane, IUGR, they're all common in case of obesity and pregnancy. Higher risk of the cesarean section is also in some of the cases. So which in turn causes the high risk of C-section as well as the higher it is the obesity. It is one of the or it will cause one of the obstetric complication in the form of GDM as well as the PIH, pregnancy-induced hypertension, and preeclampsia. So all this is called complicated pregnancies. So these complicated pregnancies, which will invariably the patient has to undergo the C-section. In turn, it will cause the hospital expenditure and stay in the hospital. And obesity and pregnancy, it also causes the effect on the infants, especially the fetus. So mainly the neural, this one, they have studied the, according to BMI, when the BMI is less than 30. So all these infants related mortalities as well as the defects, they are less, especially the neural tubal defects, miscarriages as a macrosomia and stillbirth. And some cases they also found out the cleft lip as well as the cardiovascular anomalies also. Whenever the obesity is more than 40, so there all these complications in the infants are twofold, more than twofold. Obesity and breastfeeding. Maternal obesity is associated with the decreased intention to breastfeed as well as the decreased initiation of the breastfeeding, decreased duration of breastfeeding. So according to some studies, they have found out whenever the maternal obesity, it leads to the not only the intention to the breastfeed in a woman, as well as it is a decreased initiation of the breastfeeding, as well as a decreased duration of the breastfeeding. So, some of these effects may be cultural or having to do with one's own body image or physiological, caused by the metabolic and hormonal effects of adipose tissue, which will cause decreased milk supply. More pregnancy complications also have negative effects on the breastfeeding. And obese women had lower prolactin responses to suckling in the first week compared with the normal weighted woman. And obesity, so because of the high adipose tissue, and it will also impair the memory gland memory development. So because the impairment of the memory gland development, because the hormonal and metabolic effects, this is also one of the cause for the milk production also it will be less. So it is also one of the cause for the breastfeed, why the breastfeeding is it will be impaired in obese persons. Obesity in various life stages, and last stage is the menopausal. So obesity is common in postmenopausal women, which in turn causes the increased risk to develop the type 2 diabetes mellitus, coronary artery disease, and increased risk of endometrial, ovarian, as well as the breast carcinomas. So so many studies they have done already. So there is a direct proportions between, directly relations between the obesity, means BMI waist hip ratio, the waist circumference in relations with the type 2 diabetes mellitus. And similarly, the obesity is the independent risk factor for the coronary artery disease, and especially the waist circumference, it means abdominal obesity. It is also one of the increased risk for the CADs, means coronary artery disease. And especially the obese women, they are prone to develop the carcinomas. Especially the what carcinoma means, mainly the endometrial carcinomas is very common, and breast carcinomas are very common. So why the obese women are mainly prone to develop the carcinomas? According to some studies, it is a 3 to 5-fold increase in postmenopausal group related to the carcinomas. So why means there is the mainly the unregulated estradiol, it will be more estradiol means estrogen. So which in turn will causes some of the metabolic changes, or some of the cellular immunity will also be reduced, and they are more prone to develop the carcinomas. So according to some of the studies, whenever the obesity is treated properly, especially by the surgical therapies and all, and they have found out the chances of the incidence of the carcinomas are less, especially the breast carcinomas as well as the endometrial carcinomas. Among these carcinomas, the breast carcinoma is the highest incidence in obese persons, and it has got more mortality, more morbidity, as well as breast carcinoma, they have got the surgical complications also. And most of the time, the patients with the breast carcinomas, they tend to develop the secondary metastatic changes very soon. That is one thing. And second one is they are developing the other involvement of the other breast is also very common. So the breast carcinomas is very much related to the obesity, means incidence of the BMI. And second one is the endometrial carcinomas as well as the ovarian carcinoma. They are also, but compared to the breast carcinomas, there is a less incidence of these carcinomas in obese women. Menopausal women are more prone to develop the hypothyroidism and hypovitaminosis D, which in turn leads to the musculoskeletal pain as well as the osteoarthritis. So, according to some of the studies, the postmenopausal women, they are more, the incidence of hypothyroidism more in postmenopausal women. So, the hypothyroidism in turn which will causes the hypovitaminosis D also. So, all obese persons, they are more prone to develop the hypothyroidism and hypovitaminosis D. Of course, it is a vicious circle. And because of this hypovitaminosis D and the postmenopausal age, they are all prone to develop the osteoporotic changes. So because of that, they are going to develop the musculoskeletal pain, especially the low back pain. So the cause for the low back pain in postmenopausal women especially, it is due to the mechanical stress over the intervertebral disc. There is one thing. And second one, the indirect effect, because already the atherosclerotic changes have been going on in the arteries. So the arteries which are supplying to the intervertebral space, they are also causing the ischemia as well as the pain. This is the second cause for the why the low back pain is more common in case of postmenopausal as well as the obese persons. And one more thing is osteoarthritis, especially the knee osteoarthritis is very, very common. Why means because of the obesity, the whole body weight will be loaded on the joints, and they are more prone to develop the cartilage turnover, it will be more. And one more thing is the degeneration of the meniscus changes will be the degeneration of meniscus tears. They are more prone to develop the frequent tear of the meniscus tears. So because of that, they are prone to develop the osteoarthritis. And obesity, these are the comorbid already I have explained. Among that, one more is the obesity and depression. So the cause for the depression in obesity is mainly again the hormonal effects will be there, and some of the metabolic effects will be there. And most of the time, the obese woman, they always be having the low self-esteem. That is one of the things, low self-esteem. And even the general public, as the health professionals, they also look at the obese persons a little bit of in the low level. So because of that, usually the obese person, they'll be losing confidence, even though whether I take the medications or whether I undergo any of the procedures related to the obesity reduction, whether I'm going to improve. So the general public and health professionals also, they will look at them in the different ways, and basically also they'll be having the low self-esteem. And last one is already explained, obesity and cancer in women. These are the consequences of obesity. Of course, obesity is a systemic disease. it is not a disorder. It is we can call it a systemic disease. So it will cause each and every organ or each and every system of the body. It will be included in the complications of obesity. Coming to the pulmonary complications, mainly the pulmonary obstructive sleep apnea is common, and abnormal functions, lung functions are also common. And most of the time, though, because of obstructive sleep apnea, they are prone to develop the pulmonary hypertension and right-sided heart failure. This is also common. And they are prone to develop them because of the obstructive sleep apnea. Morning hours, they'll not be alert, and they are prone to develop so many mental disorders. Okay, and their orientations, it will be also becoming less. Memory will be impaired. And coming to the hepatobiliary system disease, they are prone to develop the non-alcoholic fatty liver disease, and which in turn it will cause the steatosis as well as the cirrhosis. Of course, cirrhosis percentage is less, but still we have to keep it in mind. One of the cause for the cirrhosis is non-alcoholic fatty liver disease. Then gallbladder stone, especially the obese woman, they are prone to develop the diabetes mellitus. Along with that, uncontrolled diabetes is very, very common. Uncontrolled means when the HbA1c is more than 9%, they are prone to develop the polylithiasis according to some other studies. And gynecological abnormalities, mainly the abnormal menses, infertility, and polycystic ovarian syndrome. And especially in case of pubertal age, the obese young girls, they'll be getting their menarche 3 months to 1 year earlier than the normal weight girls. Then similarly, the idiopathic intracranial hypertension, it is also one of the related to the CNS system, stroke, cataracts, already these things I explained. And the obesity, one of the important complications is phlebitis. So phlebitis, especially lower limb phlebitis, they are more prone to develop sometimes the recurrent thromboembolism. Then coming to the management of obesity, in the management, usually already I discussed, the history is very, very important. So depending upon the history, we can think of what is the cause for the obesity in a given patient. Because the causes of obesity are many in a given patient, the cause is it will be different. So we have to, before treating the patient, so we have to find out the cause for the obesity. Then according to that, we have to find out whether if the secondary causes are there, then definitely you can help the patient. If the genetic related causes are there, then definitely sometimes it is not able to treat the patient properly, or sometimes it is difficult. And in those cases, we have to counsel the patients. Then coming to the lifestyle changes, especially in this diet and exercise is very, very important. And pharmacology, when the diet and exercise, they will fail, then only we have to go for the pharmacological mode of treatment. Then others are lastly the bariatric surgeries. In the lifestyle changes, the SMART, that is specific, measurable, achievable, reliable, and timely. So the minimum 150 minutes per week, we have to do the moderate physical activities. So that is very important. And second one is the weight loss. It results in the improvement of endocrine parameters, such as decrease in the testosterone, lower fasting insulin levels, and increased frequency of ovulation. So in some of the studies, they have found out that so decrease in 5 to 10% of the weight loss. So definitely it is going to cause some good effects on the health issues. But nowadays, the cosmetic, because of most of the people, they are going for the surgical therapies because of the cosmetic, because the cosmetic effects, they are more giving importance for the cosmetic effects rather than the benefits of the health issues. In addition, weight loss causes a significant reduction in the central fat deposits and return of normal menstrual cycle in 4 out of 5 patients. Then specific dietary advices. So usually you have to tell the patients they have to use more of the fiber contained diets, fruits and vegetables. Should be more than 50% of their plate. Then fat should be reduced and eat a low fat diet and don't increase the number of calories. We have to advise the patients. Then avoid the drinks containing the added sugars. And pharmacological intervention. CNS acting drugs, mainly the appetite suppressors, sibutramine and cannabinoid receptors antagonist, that is mainly the rimonabant. But these drugs have been banned in view of neuropsychiatric effects. Non-CNS acting drugs, mainly the orlistat is a commonly used drug. So because of its less side effects, and mainly it is the lipase inhibitor. But only thing we have to care for the fat soluble vitamins depletions will be there. So we have to supplement the fat soluble vitamins. Then other medicines are especially the metformin, then GLP-1 antagonist we can use. Then recently those drugs we are using, but most of the time the cost effect also, and in a long run patients cannot afford those drugs. Coming to the bariatric surgeries, the indications are BMI more than 40 kg and BMI if it is 35 to 40 along with the comorbidities, then that's one of the indication. Then some of the bariatric surgeries are sleeve gastrectomies and gastric bypass and single anastomy. I'm not going to discuss in detail about the surgical therapies. Then coming to the conclusion, obesity it affects fertility. Obesity it reduces the success rate of fertility treatment. No single intervention is effective. Sometimes the mode of treatment will be the multiple, mainly not only the lifestyle measures sometimes may not benefit. So we have to add the pharmacological line of management. If it also fails, or in patients already discussed indication for surgery, in those cases, surgery may help. Not only individual, it also becomes important that government takes initiatives and start certain programs which would give the health education on healthy food habits and limitation of industries producing the more empty calories and increase the screening facilities for health issues caused by the obesity. Obesity is a preventable and it is a treatable disorder. Systemic approach to the patient with management, consistent mandatory lifestyle modification, sometimes need combination of also very important.
So I'm attending the conference.
Obesity is becoming more prevalent and has wide-ranging effects on a variety of women's health issues. Clinicians should counsel all women about the broad negative effects of obesity and the importance of controlling the weight to prevent the negative outcomes. By following the healthy discipline lifestyle measures and spirituality in our day-to-day life, women can lead a healthy life and be an asset to respective countries by strengthening socio-economical impact. Thank you for your listening.